Hello everyone, welcome back. Hey, if you want to see more of my videos, click the little subscribe button below. You get notifications and get to see more fun stuff from me. This video focuses on a massage of the calf and the feet. The pain that people typically feel when these areas are stuck are plantar fasciitis down in the foot, Achilles tendonitis, so the tendon right behind the heel, frequent ankle sprains, and then just pain up in the calf itself. And all of these can address that. The thing to remember with pain in the feet is it's typically caused by stuck parts in the calf muscle up higher. And so in order to get rid of these conditions, you have to focus on the calf muscle and get those released. And one of the frequent perpetrators in some of these problems is a stuck soleus. Well, that is the muscle underneath your top calf muscle. You have two calf muscles, and the soleus frequently gets stuck just kind of together. It's typically in the area where I'm at right now. And so by doing these really gradual stretches and just kind of digging in there and pulling will help fascia release. And the key is to do it really slow and gentle so that the body responds to it. Fascia reacts to slow movement. When you go through it fast, it kind of tightens up and it doesn't want to release, so you gotta go slow. Using downward strokes seems to be a more effective method in just what I've experienced in my practice. Kind of helps flatten the muscle out, and the calf just seems to respond to massage in that direction a little bit better. The key is always to go slow and be very patient. When you get to areas that feel stuck, you should stay there and just hold it and wait. Wait for the body to relax. Wait for the client or the person being massaged to relax and help it to let go. Again, more soleus work here. I'm pressing into the soleus. Sometimes I work on separating the soleus and the gastrocnemius, which is the muscle above it. And then sometimes I go below the soleus, pulling it away from the tibia, which is that bone there. And both are really effective. You really want to focus on the middle of the leg where both of them kind of meet and go their separate ways. That's typically an area that's really stuck. Sometimes these muscles can be so tight that the muscle can actually flip over because it's just pulled so tight that it's not laying flat. And so some of these techniques can help flatten it out and reduce the pain, reduce the injury. You definitely want to go to the inside of the lower leg. Sometimes this can be done more effectively when the client is laying on their side and that leg that I'm working on would be extended behind them, so you can get more of a good pressure going in the way that you want to go there. And again, I'm focusing on the soleus, pulling the top muscle away and making sure you get underneath it. I always finish off my massages, or I should say almost always, with gua sha because, again, it is so effective in getting rid of chronic stuff. It helps get it out of that chronic state. It helps release the fascial adhesions. In the calf, there's usually a lot of adhesions right there where I'm focusing. I keep going back to it because I feel little grainy parts right behind the knee. And there's a few things that come through here. You know, you have both of your calf muscles come up and connect. The gastrocnemius goes all the way up to the upper leg, and it just is typically really stuck. So making sure that you get those tendons at the top will really help. Now you have to, of course, go down into the feet if you want to help relieve some of these symptoms. Even when there's pain up in the calf or hip or back of leg, the feet should never be ignored, and when the feet can't move effectively, it can really cause problems higher up in the body. So focusing on making sure that there's kind of some mushiness where my thumbs are, and just, so that it can flex and it can move when the person is running or walking, can really help the whole entire body. Now, when people experience plantar fasciitis, a good portion of them actually experience the pain right here and not directly at the heel. In my experience, more people experience it in this area, and that's usually where it feels stuck. So when you get in there, it feels thick, it feels like it doesn't want to move. And so one really effective way to work that is to do some active release, which we're doing here right now. That is where the client will point their toe or flex the foot, and as you go down the foot, they're going to pull the toes towards the front of their leg, and this can aid you in releasing some of those muscles on the bottom of their feet. And of course, it's not complete without using a little glossa on the feet. This really can break up a lot of the stuff that's built up over the years on the bottom of the feet. This can be somewhat uncomfortable sometimes, especially if the person has a ticklish reaction. So you may want to take breaks in between working on the feet there. But when people experience pain there, usually they'll do just about anything to get rid of that pain. So go and give it a try.